In the last podcast, I discussed adrenal glands and their function in the body. I briefly also discussed some of the things that you can do to help your adrenal glands. But what exactly does adrenal fatigue or adrenal dysfunction look like? In today's Ask Dr. Gill podcast, I want to talk more about adrenal fatigue and what symptoms you might be experiencing that could be causing that problem. So stay tuned. Hello and welcome to Ask Dr. Gill. I'm Dr. Gill Winkleman. And on today's podcast, I want to talk about adrenal fatigue and what it looks like. So for those of you who didn't listen to the last podcast, and maybe you don't want to do that right now, that's fine. I want to just give you a quick overview of what I talked about. So basically, the adrenal glands are these small tissue that sits on top of the kidneys. And they have a variety of functions in the body, including blood sugar regulation, fight or flight response, hormone control in terms of sex hormones, both in men and women, and urination concentration. And so oftentimes the problems that we see related to the adrenal glands are related to those functions. And I talked about that in the previous podcast, but it's interesting that oftentimes people think that the adrenal fatigue is exclusively in the realm of feeling tired, and that you don't have any oomph, you don't have any get up and go, and sometimes that is the case, and so oftentimes though that problems present completely differently and almost the reverse of what you would expect. So that's why I wanted to do this podcast. So that one of the aspects of the adrenals that's interesting from my perspective and my learning is sort of the function and the timing of that function. What do I mean by that? Well, in one of the naturopathic philosophies of how we develop is that we're born with every organ system. And there's a balance that is required between each of the organ systems. There's an interplay between each of them. But our bodies, as we develop and grow up, will have a preponderance towards developing the particular organ system. And so, for example, the ages of 2 to 7 is a time where our digestive systems are forming, and we're learning to assimilate food and digest food appropriately. It's when our gut flora, the bacteria that live in our gut, is kind of finalized. So that's the aspect that I'm talking about. And the adrenal glands basically, develop up until the time that we're about 2 years old. And it's interesting, when I first learned this, I thought, well, we're born with this stuff. Like, that's not possible. It actually turns out that oftentimes injuries that occur at a particular age will affect the organ system in question. And so, for example, a head injury before the age of 2 has more impact on the adrenal glands than it would on the digestive glands. So even if the head injury doesn't cause mental emotional issues, for example, or learning issues, it can affect the way that the adrenal glands function in the growing child and the adult. So it's a clue sometimes for us that we can look at sort of what's going on in the body and figure out that something happened at a particular time in childhood. And that's one of the ways that I look at naturopathic medicine and how to treat things. And so what's interesting about the adrenal glands is that the issues that show up, because it's before the age of 2, it's really preverbal. So from a psychological point of view, it's often difficult for patients to kind of connect to that. So an adult patient who comes in who doesn't necessarily know what's going on with them, they might have this sense of not just fatigue or whatnot, but this sense of foreboding, as it were. And very often, these issues show up as a result of trauma that happened prior to the age of 2, and they can't verbalize what that is. And that's not to say that therapy doesn't help, because I'm a big proponent of psychotherapy, and there's different types of therapies to access that information and to allow the body to process through it. It's just that we also need to work with the body as well on some level, whether it's body work or remedies that are either herbal or supplements or whatever it is that is allowing the body to sort of release that memory, if you will, that way of learning. So that's what's interesting to me about looking at this and the piece of this that's difficult to show in a podcast. But if you imagine a 6-pointed star, and each point on the star is an organ system in the body, then the organ systems that are opposite each other on that star, so let's say the one pointing up and the one pointing down, if there's an imbalance in one, usually or oftentimes the imbalance can show up on the opposite side of that. And a 6-pointed star is actually 2 triangles, one pointing upside down, one pointing right side up. And the imbalance can also show up on its triangle mate in the other 2 areas of the triangle. And so on my website, www.askdrgill.com, askdrgil.com, I'll be putting up this diagram, if it's not already up there, that was developed by one of my mentors, Dr. Dick Tom. And, this is kind of how I look at the body. And it's an important aspect of how imbalances in the body show up. Now, the interesting thing about the adrenal glands is that because it's so early in our development, the imbalance can show up anywhere in the body. And so it's really challenging to unwind that and to see that is where the imbalance is coming from. So this is the challenge, this is the difficulty in treatment, and it's also usually the last thing that gets better before moving forward. So that's not always true, but often that is the case. So what are some of the symptoms that might show up with the adrenal glands? And, well, the obvious one is fatigue. And oftentimes I have patients coming who are just really, really tired. And the hallmark of this is that they are really, really tired, and it doesn't matter how well they sleep, but oftentimes they're really, really tired and they sleep well, or they report sleeping a lot. And it's different than thyroid, because usually the thyroid is tested and it typically comes back normal, but oftentimes when it doesn't, it's not necessarily because the thyroid's out of balance, it's because the adrenals are out of balance. And so some of these people will take thyroid, and it may, or have been on thyroid, and it may or may not have helped over the time. So that's usually a clue to me that it's not about the thyroid, it's about the adrenal glands. And most of my patients that have had thyroid issues as a quick aside, actually had adrenal issues before that. And the exception is I have patients who either were downwinders from radiation and had radiation damage to their thyroid, and that's obviously a different case. And I also have patients with autoimmune disease who had ended up having their thyroids removed, either Hashimoto's or something else going on. And so those patients obviously wouldn't be able to survive without thyroid meds, but oftentimes they still have adrenal issues. And so those treating those can help stabilize the thyroid. So the interesting thing, though, is that you would think that if your adrenals were tired, that you would not only be able to sleep, you would just sleep all the time. And the interesting thing that I see with the adrenal glands is that it's not necessarily the case. And usually one of the first signs of adrenal issues is difficulty sleeping. So people will find that they either get tired during the day and not at night, or just have trouble settling down at night, or they sleep maybe from 3 a.m. to 9 a.m. And that's usually indicative of an adrenal issue. And what's going on is that their cortisol levels aren't really being maintained at the appropriate level at different times of the day. So the fatigue will kick in later in the afternoon, and it'll be really bad, like it will be a crash. But then they'll get a second wind in the evening and then not be able to go to sleep until midnight, after midnight, mid-morning type thing. So that's usually a sign of adrenal issues. I'm going to take a break, and then I want to talk about the adrenal issue that is very, very common, which has to do with attention deficit disorder. So stay tuned. Okay, welcome back to Ask Dr. Gill. I'm Dr. Gill Winkleman. So if you have questions or have a topic that you want me to cover, feel free to send an email at info at askdrgill.com, and I will try and cover it. And, that's how some of these topics are actually done, is people send me emails and they ask a question, and I will answer it on, the podcast. So, and definitely check out the website, because there's lots of good information on there. And I do have a newsletter, and I'm working on getting that out on a semi-regular basis along with this. But this actually takes priority of that. Okay, so let's talk more about the adrenal glands and the relationship between that and ADHD. So I mentioned that if an injury happens before the age of 2, it can affect the adrenal glands more than anything else. And there was an interesting study done probably about 10 or 15 years ago that found that a head injury before the age of 2 would double one's risk of ADD by the age of 7. And at first it's sort of, you look at that and you say, well, duh, they hit their head, they're going to have trouble as a result of that. But the researchers looked at something else that was interesting. And what they looked at was what happens if another injury happens before the age of 2. And in this case, they looked at burns, and they found that if one had a severe burn before the age of 2, they were 1.5 times increased risk of ADHD by the time they hit 7. So it was curious. And kind of what we think may be going on is that what is classic ADD or ADHD is actually an adrenal misfunction. And that's actually how I treat that. So oftentimes I'll use neurofeedback to treat attention deficit disorder. But what I found is that for a certain number of people, particularly if they did really, really well with, an amphetamine type drug, either Ritalin or Adderall, that those people typically had an adrenal dysfunction. They weren't producing the appropriate amount of epinephrine or norepinephrine. And the analogy I like to give parents, or even adults if they have it, is if you watch a toddler who's really, really tired, like past nap or bedtime, and they kind of run around like crazy and they just go from one thing to the next, that's where they're like past needing to go to bed. And it's actually can be difficult to get them to bed because they will, fuss and have trouble falling asleep because they're trying to amp themselves up to stay awake. And if you get them to bed before that happens, and you're regular about it, they'll sleep great. They'll sleep great through the night. So, but if you don't, you end up having to kind of lay next to them and figure out a way to calm them down, and then they fall asleep. And if you have little kids or big kids, you went through this, you know exactly what I'm talking about. It becomes sort of this nightly challenge of getting your kids to sleep. But that's what goes on in the 7-year-old as well, or 10-year-old, or 50-year-old, depending on the age. And it's more about the adrenal glands. So that's why, the amphetamine type medications are helpful. It's that they amp the body up enough that then you can start to focus. Because before that, you're just trying to do something to stay awake. And, as a simple example, if you're in the corporate world and you're in a meeting and you're tired and you start fidgeting so you don't fall asleep in the meeting, it's the same basic idea. And it's not that necessarily that you have ADD in that particular case, by the way. It may just be that you didn't get enough sleep, for the last however many nights, and have been working too hard and need to take a vacation. So that's the connection in terms of the ADHD, though. And the difference is that in a typical person, they'll get enough sleep and their adrenals will return to a normal state and they'll be able to stay awake. In the ADD person, if their adrenals aren't functioning, and you haven't done any input, by the way, to help them heal, that state continues. And that's why they keep having trouble over and over again. So in terms of treatment, treating the adrenals, you're better off, because then the adrenal glands are healed, you sleep better, you have fewer problems elsewhere in the body. And there's some evidence of long-term effects from amphetamines, and it doesn't seem to be the amphetamine per se. It's that it's masking the underlying issue, which is that there's an adrenal dysfunction. And so that's why I like to treat that and try and get a restorative state that goes on in the body. So in the last podcast, I mentioned some of the treatments as far as treating the adrenal glands. And, obviously having a routine, not just in terms of when you go to bed and when you wake up, but also when you eat meals. Like, routine is really, really important. It's really important if you have kids that are before the age of 2. Routine is so important for those kids, and the ability to do that also can help solve some of the sleep issues that show up in today's world. That's out there for any of you if you do have little kids. So it's also really important for us, even if we're adults, to have that amount of routine. It helps our adrenals know when to shut off production of certain hormones and turn on production of other hormones. So those, that's one of the things that I recommend as well. That's all I have for you guys today. I covered a lot in the last 2 about the adrenal glands, but I kind of wanted to leave it there. If you have questions, feel free to send me an email. Again, it's info at askdrgill, askdrgil.com. And I look forward to talking with you again next time. Have a good week. Take care.